my name's Christina. I'm going to be your nurse today. I just wanted to come in and talk to you a little bit. I just need to verify I'm talking to the right person. Can you give me your name and date of birth? Minnie. Okay. That's what it says right here on your band. So Minnie, I just wanted to talk to you about what we're going to be doing today. I need to do a head to toe assessment on you, and that just means I'm going to be looking at your skin, listening to your heart and lungs, and doing a few other tests just to see where we're at. So does that sound like something that we can do today? Perfect. So Minnie, before we start, can you tell me, are you having any pain today? On a score of 1 to 10, 1 being no pain and 10 being worst pain ever, what would you say your pain's at? 0? Okay, good. I'm just gonna wash my hands before we get started. Okay, and while I'm doing that, I'm going to be doing my general assessment while I'm talking to her, and it would just be general assessment of her grooming, make sure she's wearing the appropriate clothing for this visit. Is her skin okay? Is there any obvious issues with her vision, hearing, or speech? And I'm going to be checking her mobility, make sure she's able to do this assessment. Okay, so I'm just going to sit you up. So before we do our assessment, I would be doing your vitals, which would be your blood pressure, check your heart rate, your respiratory rate, your oxygen saturation, and your temperature. Okay, so washed my hands, we did your vitals. So I'm going to start the head to toe assessment with your scalp. So I'm just checking your skull bones, checking your scalp, make sure there's no lesions, no excess dandruff, and no infestation. I'm checking your hair to see how thin, thick, if there's any patches, and it looks good. So I'm just gonna palpate back down your neck, check your lymph nodes. Now Minnie, I'm gonna check your TMJ. I just need you to open and close your mouth. Perfect. Now I'm just gonna check your glands. Okay, now I'm just gonna palpate your sinuses, your frontal sinuses, and your maxillary. And I'm just gonna check your lacrimal glands since I'm right here. They look good. Okay, so I'm just gonna have you do a few faces for me just to check your facial nerves. So can you furrow your eyebrows for me, raise them, good. Clench your teeth, and blow out your cheeks. Okay, that looks good. So I'm just gonna have you open your mouth and say ah, making sure your tongue comes out even. I'm gonna check your oropharynx, make sure that it doesn't look red, swollen, inflamed. I'm gonna be looking at your mucosal membranes of your mouth, checking your teeth, gums, and lips. Now while you're saying ah, I'm just gonna check your gag reflex with my tongue depressor, and it looks good. Okay, now after that, let me check your vision, okay? So go ahead and just keep looking forward for me. I'm just gonna pass this light against your eyes. And I'm just checking your pupillary response, making sure that it's even and I don't see anything wrong with that. Now, if you wanna follow my pen, I just need to check to make sure your eyes are moving the same. So, okay, keep following, perfect. Now I'm gonna check for accommodation, keep your eyes on my pen. Great. Now, let me just check to make sure the corneal reflection is the same. And it looks even. Okay, Minnie. Next, I'm gonna be looking at your ears. So first, I'm just gonna be looking at your auricles, see if there's anything I can visually see wrong. They look good. Then I will palpate them, both sides. With my otoscope, I'd be looking inside the ear canal, but I don't have it, so I'm gonna use my pen light. And I will just be looking for any inflammation, any lesions on your ear canal, checking the tympanic membrane, making sure there's no perforation, making sure it's pearly and white and it looks good. Next, I'm gonna be checking your hearing. So what I'm gonna do is I'm going to hit this And I'm going to place it on the top of your head, and you tell me if you hear the vibrations evenly on both sides. You do? Okay, good. And then behind the ear, behind, good. Now I'm going to step behind you. I'm just going to check your field of vision. So you let me know when you can see my hand in your peripheral vision. You just have to keep looking forward. Perfect. Now, a couple more vision tests that we need to do before I move on. Can you read that for me? Okay. Now, go ahead and look at that chart on the wall. Can you read the smallest line for me? What is the smallest line that you can read? All right. Next, I'm going to move down to your neck, and I'm just going to palpate your nodes. I'm going to be looking for any jugular distension. They look good. And then I'm going to check your carotid, each side individually. Check your carotid pulse. Palpate your trachea, make sure it's midline, and gently palpate the thyroid, make sure it's not enlarged. And it all looks good. Now I'm going to listen to the carotid arteries just to hear if there's any excessive bruise. That sounds good. Other side. Sounds good as well. Okay, Minnie, can you go ahead and turn your head to the left and then to the right, up and down. And I'm just checking to see how your function is with your neck. Now, I'm going to press my hands on your shoulders and you push up against them. I'm just checking to make sure that it's even on both sides. Perfect. Now I'm going to check your upper extremities. Try your arms. And I'm checking the skin, the muscle, make sure on both sides your muscles are even. I'm going to check your pulse right here on the inside. I'm going to check your nodes right here on the inside of your elbow as well. They all look good. Now let me just check some range of motion in your joints. Can you do some circles for me? Great. Your wrist looks good. Joint mobility at the elbow looks great. Now let's check your strength, okay? So I want you to go ahead and push up against my hands, okay? Push down. Now we'll have you stretch your arms out and do it again. Press up against my hands and down. Great. That all looks perfect. So now I'm gonna have you sit forward. Let's sit you up a little better. So I normally have my patient sitting forward, but Minnie here doesn't sit very well. Okay, Minnie. So first I'm just gonna percuss all the way down. Both sides. Checking the spine, making sure it's straight. Now I'm gonna check the kidneys. Now I'm gonna check for thoracic expansion. Go ahead and take a deep breath, making sure both my thumbs move equally on both sides. Okay, now I'm just gonna check one more thing. Go ahead and say 99 for me. 99, 99. Perfect. All looks normal. Next, I am going to listen to 10 different points of your lungs, okay? So just go ahead and breathe normally for me. Keep breathing normal. All right, that sounds great. Now before I move on, I just want you to take a deep breath and then hold your breath. I'm going to check one more thing. Okay, that all sounds good. Next, we're gonna move on to your chest. So I'm just gonna check the chest muscles, make sure they're even. I would do this both sides. Check your axillary nodes, and they're normal. Next, I'm just gonna listen to your heart. Listen to the aortic, artery, pulmonic, down the second pulmonic, right underneath your breast, and down to the side at the apical site. This is where I would listen for 1 minute if I wanted an accurate heart rate. Now I'd have the patient turn over to her side and listen again to the heart. Just gonna percuss the chest. Listen to the different sounds over the lungs. Perfect. Okay, I'm just gonna lay you back and I'm gonna do an abdominal assessment. Up a little bit, keep the patient covered, making sure she's always has privacy. Okay, I'm just gonna lift up your gown. First, I'm gonna do my visual inspection, then I'm gonna osculate to make sure I don't mess any bowel sounds by percussing too soon. Then I will percuss, and last I'll palpate. So on visual inspection, everything looks good. I don't see any abnormalities. Then I will listen. So I will listen to 1 minute. I will listen 1 minute to each quadrant. Right lower, upper, right upper, and lower. Okay, so that all sounded good. Next, I'm going to percuss all 4 quadrants again. And last, I'm gonna lightly palpate. Okay, I'm gonna listen to your aorta and to your renal arteries as well as your iliac veins, and just make sure I don't hear any bruits. And I'll do this with the bell. And then I'll listen to your femoral arteries, okay? Check your femoral pulses. All right, now while you're laying there, I'm just gonna have you move your hips. I'll have you move your leg up, over, and down to check your hip mobility. Make sure you're not having any pain with mobility in your hips. I'll have you bend your knees. Also checking for mobility. Sorry, gotta check you out a little better. Bend your knees, bend your ankles, and wiggle your toes, just checking all those joint mobility. Next, I'm just gonna feel with the back of my hands all the way down. Check your shins for any edema. They look good. And I'm gonna check your pulses on your lower extremities, so that'll be the pedal pulse, the posterior dorsal, and the popliteal. And I'll check it on both sides at the same time to make sure that they're even, they're equal, and one isn't stronger than the other. Okay, so we've done the upper extremities, lower extremities. Listen to your other pulses. Okay, I think we'll move on to the neural assessment. So I'm gonna just cover you back up and have you sit up for me. So I'm gonna get a broken tongue depressor, and I'm going to place either the sharp or the blunt side against your skin, and you will tell me if you feel pointy or soft. And this is just checking for your sensitivity, and we'll start on your face just to make sure you have your facial nerves are feeling that sensitivity. So go ahead, tell me if it's pointy or soft, pointy or soft, pointy or soft. Great, thank you. Next, I'm going to use my fingers, and you'll tell me if I'm touching you with 2 fingers or 1. Go ahead. 2 or 1, 2 or 1, 2 or 1, 2 or 1. Great. Now, the same thing with vibration. I just want to make sure that you're feeling it every spot that I'm touching. Can you feel that okay? Perfect. Now I'm going to have you close your eyes, stick out your hand, and I'm going to place an object in your hand and you tell me what it is. A pen, correct. Now I'm going to draw something in your palm, keep your eyes closed, and you tell me what the figure is. A figure 8, right. Okay, Minnie. So while you're keeping your eyes closed, I want to check your finer motor skills. So go ahead and touch your finger to your nose. Great, other side. Perfect. Good, you can go ahead and open your eyes. Now go ahead and touch your finger to mine. Great. And can you touch each finger to your thumb, both hands? Perfect. So Minnie, I'll have you stand up now. I'm gonna have you bend over so I can check your spine. Go ahead and stand back up and twist, just to check that mobility of your spine. And we're gonna check your balance by doing a couple tests. First, I'll have you stand on one leg, and then the other. I'll have you step one foot in front of the other. And then if you can just walk back to me normal so I can check your gait. Perfect, that's all great. And okay, Minnie, I think that's everything for us today. Do you have any questions or concerns about what we've done? Okay, so I will just give you some more information. If you have any questions, go ahead and give us a call and we can answer those. I think that's it. So you have a great day.